Hello guys and welcome back to my channel. Guys, in this video we will be talking about the books which you have to follow or should follow at the time of your residency. Guys, studying in ophthalmology residency could at times be overwhelming because many a times we are not exposed to the books or the resource material at large at the time of our internship or at the time of our MBBS days. So when we enter ophthalmology residency, it comes to you like a totally new subject, which is little difficult to understand, especially because of the anatomy of the eye, which is a 3D structure. So you have to understand everything in terms of 3D and quadrants, which can at times be difficult. And secondly, the subject could also be overwhelming because you do not have just one standard book to study everything. So here I am making a small attempt to help you guys with the books and the resource material to study at the time of your residency. Guys, I'm Dr. Shaurya Verma, and of course this is just my opinion and few books that I am mentioning in this video. You may come across many such books and resources that could help you. Please help others by writing those material which has helped you in the comment section below, so others can also read it and get its benefit. These books and resources which I am going to tell you in my video is my opinion of what you should go through and know and read at the time of your residency. So without much ado, let's get started with the video. So guys, to help you understand how you have to proceed learning and studying in your residency, I have divided the resource material available into beginners category, intermediate category and advanced category. Guys, stay tuned till the end. I'll also be sharing some of the online resources which will be of great help to you because illustrations, diagrams, radiological point of view and surgical skills that you need at a time of assisting the surgery and performing the surgery. So stay tuned till the end. So I'll start with the beginners category. So for the beginners category, you actually would have read and know about two books at the time of since the time of your internship or MBBS days, and these two books would be Comprehensive Ophthalmology by A.K. Khurana or Parsons Textbook of Ophthalmology. So both these books are good when you are studying for MBBS level exams for your PG entrance. Both these level books are very good. So Parson, I would like to say that it is a very good book if you can learn it, understand it and study it. But at times it could be very vast to learn Parson because it's not a comprehensive book. So at the time of your MBBS, it might be difficult to study Parson at whole. But if you have studied Parson at whole, please go ahead with it in your residency days as a beginner level book. If you have studied A.K. Khurana at the time of your MBBS, then you can go ahead with A.K. Khurana as well. The book is good in terms of its illustrations, its diagrams, its photographs, and also the nature in the book is written is like a notes. So it is very easy to learn it and grasp it. So if you have learned that book, you can go ahead with that book in your residency as a beginner level book. So beginner level, there are two books, whatever you prefer or you have already read. That is among A.K. Comprehensive Ophthalmology. I must be having it. That is Comprehensive Ophthalmology by A.K. Khurana, or maybe if you would have studied Parson, then go ahead with Parson. Second thing which I would like to tell you, that when you will enter your residency, it will be much of practical thing and many things you would need to know at the time of your clinics and OPDs and minor OT procedures. And you need to have this one book, that is Bill's Manual for Eye. It will help you with your clinics and diagnosis of the patient. You can carry it wherever you go and be thorough with that book for your clinics. Another book for the same is by Namrata Sharma, Atul Kumar and Praful Kumar Maharana. This is also a book for clinics and you can go through this book at the time of your clinics. Beginner level book, we have two books. You have to choose from the two books, that is from A.K. Khurana or Parsons. That is the first level. And secondly, for clinics, you have to choose from Will's Manual of Eye, which I would recommend. And secondly, you can also go for Namrata Sharma book. Guys, we also have one more book for which is very good for learning, giving exams and giving tests in your residency. And it might not be very helpful to clear the concepts, but it is very helpful to give exams. So I'll also mention that book. That is FAQ by, that is Arvind's FAQ in Ophthalmology. You can buy this book. This book is written in the format that you have questions and then answers for those questions. So you can learn it, read it and at times it could be helpful, especially for the points which you have to learn. It is not very good book for knowing the concept and understanding the concept, but the things which is fact based things you can just learn from this book. Okay, so now moving on to the intermediate level books. So the one book which is highly recommended, and I think you'll start hearing it from first day of your residency, and all of you will study that book, is Kansky's Clinical Ophthalmology. You all will study this. This book is going to be your best friend at the time of your residency. You have to study from this book. This book is very good with its illustrations, with its pictures. Anything that you see in your patient and you do not understand, you can come back and search for that picture in the book and you'll get that picture. This book has very good illustrations with pictures like this illustration. This has very good illustrations of pictures. You might not find a book like this. It is very good. When you see a patient and come back and search for it, you will find a similar picture in this book. So it is going to be your best friend at the time of your residency. Now this book could be is very good for learning with the help of pictures and illustrations, but you might feel that this book is not giving you the exact concept of the disease, because it is in the form of like written notes. So for a very good understanding of your subject, you have to refer to a book which is called Yanov. Yanov is very good for understanding, very good for concept building, and it is a very good and a must book in ophthalmology. Now guys, Yanov is a very vast book and it is very difficult to revise it at the time of your exams. It is also very difficult to make notes from that book because it is very, very vast. It will cover everything. So you're overwhelmed with the Yanov. Then there are two books which I would suggest that you can read instead of Yanov and be good with the concept building. First one is Jia Chaudhary. Books comes in two volumes. It is also a vast book, but it will give you very, very good understanding. It is written in a very, very lucid language and very, very easy to understand. So Jia Chaudhary I would suggest if you want to read in vast, understand the concept, and Yanov is little too overwhelming for you, go for Jia Chaudhary. And with Jia Chaudhary I would also like to suggest another book, that is Payment. Payment will also give you good concept building. This is Payment. This also comes in two volumes, and you can go for Payment if Yanov is overwhelming for you. Both these books are equally good and easier to learn, easier to study, easier to revise. Suggestion would be that you have to study Kansky in your first and second year. You try to cover the maximum part in first year, and in second year you'll have a lot of time because your juniors will be there, and then you can go ahead with Jia Chaudhary or Payment. There's a very small book, or maybe you can call it a mini atlas for ophthalmic surgeries. This book have lots and lots of pictures for all kind of surgeries that we perform, and this is a very small little book by Dr. Sandeep Saxena. You can go ahead and study this book. If you study this book at least a day prior to when you're going to perform that surgery or going to assist the surgery. So this book will be very, very helpful in the terms of photos, illustrations, diagrams that could help you understand the surgery better and make and assist the surgery better and maybe perform the surgery better. So yeah, that were the intermediate level books. Guys, now I'm going to tell you about the advanced level books. Now it is up to you to study these books or not to study these books. It is completely your choice. What my suggestion would be that if you're going to write thesis in a particular subspecialty, do go and read an advanced book for that subspecialty. Or if you are interested in a fellowship after your PG, then please go ahead and read that book. It is not compulsory to read those books, but of course it will give you a better understanding of the subject. So let's get started with that. So guys, for conjunctiva and cornea, you can go with Krashmer's. Krashmer is a very, very good book with lots of illustrations and lots of details about the corneal diseases. So for cornea and conjunctiva, I would suggest that you could go for Krashmer's. Uveitis, you do not have any particular book, but Will's uveitis would help you understand the subject better, and it is in great detail. So that will help you with uveitis. For lens or cataract, I would suggest go for Parson. Parson has a great detail on lens and cataract disease. For glaucoma, you can study from Shields. Shields has a very detailed concept of childhood glaucoma, adulthood glaucoma, and different other types of glaucoma. Anti-glaucoma drugs, surgeries to perform, lasers to perform. It has a very good detailed analysis and a very nice book for glaucoma. Yes, and Retina, I'll tell you a fantastic book, that is Ryan's Retina. It comes in 3 volumes. It is a very vast book, but if you plan to do your fellowship in Retina or maybe thesis in Retina, go for that book. It will be very good for your understanding. Coming on to strabismus, I'll suggest 2 books which are very good for strabismus. First one is Von Nuden. Now Von Nuden is also like a very vast book. It might be difficult to study it and then revise it at the time of your exams. So a better book to study and revise at the time of exam, which I would suggest and which I studied, was Kenneth Wright. Kenneth Wright is a very nice book, very lucidly written, very easy language to understand and also to revise. Alternatively, if you want a even easier book to go and just have a little bit concept of strabismus, because you might not be thinking about doing a fellowship in strabismus, just a little concept and a little understanding of strabismus, you can get from this book from Pradeep Sharma, that is Strabismus Simplified by Pradeep Sharma. This is a good book for understanding, but I would suggest it go for Kenneth Wright if you want to understand strabismus. It will not take a lot of time to read and it will be very easy to understand. So go for Kenneth Wright. That would be my suggestion. For oculoplastics, eyelid, lacrimal apparatus and orbit, go for Jeffrey Narad. Go for Jeffrey Narad. That is one book which will teach you everything from your theory point of view, from practical point of view, from surgical point of view. So that is one book you can study for oculoplastics, orbit, lacrimal apparatus. Apart from this, I would also like to mention few online resources which are reliable and you can go for it. You can study from those resources. First one is iWiki, that is by American Academy of Ophthalmology. iWiki is like encyclopedia for eye. So it will have all the topics, all the concepts which you would like to study from a book. Everything will be present in your iWiki. Secondly, you can go for few of the YouTube channels for improving your surgical skill. Or third one is iTube. If you just write iTube on Google and search for it, you will have different surgical videos of eye which you can see at any time, maybe see before performing or assisting a surgery, and it would help you a lot. So guys, I hope that small attempt of mine would have helped you with the resources you could rely upon at the time of your ophthalmology residency, and study from those resources. And please let me know in the comment section below if you want to know anything else about ophthalmology residency, and I'll be happy to cover it. Please hit that subscribe button and stay tuned with all the videos which I am coming up with, especially in regards to ophthalmology residency.